Welcome back. Summer is here, which means plenty of opportunities to get outside and, maybe get into shape. Dr. Robert Avino from Palm Beach Gardens Medical Center is here to tell us more about how to avoid getting hurt while we're getting fit. This is something that you see a lot in your line of work. So what do you want to say to someone who maybe, is saying, I really want to get back into a routine, I want to start exercising, but, I haven't done it in a while, and maybe a little intimidated to do that?
No, it's a good question. I see a lot of patients that are trying to return to activities when they've taken a break for a little while, and I tell them to ease into it. Definitely stretch, warm up. You definitely want to take things slow. Also, do low-impact activities, things like biking, swimming, and walking are really important.
So, yeah, take it baby steps, right?
Yes.
Don't get out there like you've been working out for a year and give it everything you've got.
Yeah, and you definitely don't want to do the same exercise over and over again. That's how you get overuse injuries and things like tendonitis.
Okay, all right. So what activity would you say you see most injuries from?
Well, I see a lot of patients are trying out the new sport pickleball, so it's very popular. It's a very fun activity. So I see a lot of people getting injured, lots of groin pulls. As a hip surgeon, I see a lot of people come in with hip pain.
Okay, and talk to us just about that hip arthritis that you were talking about.
So lots of times people come in, they think that they have an injury or a muscle injury. We get x-rays and we see severe bone-on-bone hip arthritis. And when that's the case, patients tend to require hip replacement surgery.
Okay, so for someone who is going to be getting back into, exercising, what is the process like, and how quickly can they just kind of get back into it after an injury?
Sure, so after injury, you definitely want to take things slow and definitely do physical therapy. If patients end up having to have a hip replacement, then it's a whole different story. But hip replacement's not like what it used to be. It's a lot quicker recovery. We do it all from the anterior approach. That means patients are back to sport pretty quick at 3 months afterwards, and we do it all robotically now, so it's a lot less invasive. So it's definitely different than it used to be.
Okay, all right. And, we're talking about this heat advisory that we're under, right, for the next couple of days. And here we are going into the summer. So with people, maybe wanting to get outside and exercising, what advice do you want to give them just about staying safe, not only injury-wise, but also just hydration-wise?
Well, you definitely want to stay hydrated. And if you don't have to be outside for your workout, this is a good time to do your workout indoors in a gym.
Maybe do them early in the morning if you don't have the option of being inside, or...
Absolutely, but it's still pretty hot in the morning these days.
Today it was, my gosh, you walked outside this morning and it was so hot out there.
Oh, yeah.
Dr. Avino, anything else you want to add that we didn't talk about?
No, that's about it.
All right, great. Thanks so much for being here. And if you want to listen to this interview later on today, which is going to be on our website, WPBF.com, you can also head to our website and just search fitness. We have all of these different articles on there with information that can help you out if you're looking to get back into a routine. We'll be right back after this.